So this is Shibal Bhartiya, who is an eye surgeon who specializes in glaucoma. So Shibal, why don't you give us a brief introduction of your career and what did you study and what is your main motivation to become an eye surgeon?
That's a very interesting question, Johan. So I had to first do an undergrad course in medicine. It's called MBBS in India, for which I needed to study biology and physics and chemistry in my class 12. And then I took an entrance exam, which let me become a general physician, and after that, that's 5 years. And then I had to do 3 more years of training in what is called Masters of Surgery in ophthalmology, so I could become an eye surgeon. And then I did 6 more years of training in glaucoma before I could become a super specialist. So it's a very
All
long road. Yeah.
all right,
And
all right.
your
So
motivation, that was the
yeah,
other question.
yeah,
Okay.
of course,
So, you do know I went to school with your mother.
yeah.
So we were not a very bright, happy lot. We were just happy. We weren't very interested in studying too much. But I was a very good student and I was generally aimless. Mama went on to become a journalist, right? I didn't know what I wanted to do, so I just was good at physics and mathematics. So I kept doing science. And as a natural progression, when you're good in studies, everyone said at that time, this is 1992, just take the entrance exams. And I took the entrance exams for both engineering and medicine. I qualified them both. My parents at that point spoke to me of medicine as the right thing to do, talking about service and giving back to the world. And so I took up medicine. I hated it with all my heart. I almost ran away from medical school twice, but both times I was brought back in because either friends told me, finish your graduation, you need to graduate. So I did medicine and thought that I'll do something else. And I kept doing lots of other things. And when it was time to super specialize, I thought, aankhein to itni choti choti hoti hain, they're so tiny. How much will they make me study for, and both of them are the same. So it was the smallest super specialization in the body I could find. Even if I do ENT, I have to do ear, nose, and throat, right?
Yeah.
But ophthalmology, I just have to study the eyes, and that too, the two are the same. So I thought इसमें ज़्यादा पढ़ना नहीं होगा, so I can have a life and keep having fun, which is why I did ophthalmology. And then somewhere along the way, I fell in love with how wonderful ophthalmology was and how fulfilling it was. Because of all your senses, if you close your eyes, the world is the most difficult, right? So, in so many ways, it was very gratifying to be able to help someone see. And that is why I stayed on, and ophthalmology changed my life. I became a more responsible person. I found direction in life, and I went on to study for very many years after that. From a child who didn't want to study at all, I became a padhne wala bachcha. I became a padhne wali mummy also later. I was studying even after my son was born, who's almost your age. You turned 13 now? No, you're 14. Yeah, so my son is 14 now, and I continue to study even today.
All right. So how do you use technology and how do you think technology will change the way you work for the next 10 years?
Beta, so my work is all technology based, right? All of the imaging that we do is optical coherence tomography. How much of physics have you studied till now? Do you know what is coherence in waveform? Have you done any? No, you haven't done
I
wave physics, yes. Yeah,
I
you've
know
done.
light waves, maybe.
Okay, so almost everything we study is technology, right? Do you know how much is a micron? 10 to the power of minus 6 meters. It's the thousandth part of a millimeter, right?
Yeah.
So we work in those thicknesses. So everything, all of eye surgery is based on technology. Most of our examination techniques and diagnostics are based on technology. Now, with the COVID pandemic, technology and telemedicine has come to the fore. So lots of my patients don't come to see me anymore at the hospital. I see them on Google Meet like I am speaking with you. So technology beta takes over almost all of our lives. And a lot of our surgeries now are robotic surgeries. So we guide the robots to do what we used to do earlier ourselves. 10 years, I don't know what will change, but in the last 10 years, things have changed dramatically. So I think there has been more change in the last 10 years than in the previous 50.
All right. So, what skill sets do you think it takes to be a successful ophthalmologist, and what guidance do you have for some students who look to be an ophthalmologist in the near future?
The most important thing, beta, if you want to be a doctor of any sort, one is empathy. You have to understand how it feels to have a problem. Because the biggest thing, the biggest crisis right now the world over is not technology, it's not competence, it is not clinical acumen, it is empathy. We forget how it feels. And the basic principle of medicine that we are taught when we start off, it's called prima non nocere. First of all, do no harm. And that is something we all need to remember in each of our interactions, regardless of what we want to do. The second, of course, is you have to be prepared for very long working hours. You don't, for your initial residency, which is almost the first 8 to 10 years of your padhai in your life, you don't have much time for many other things if you want to be successful. And sincerity always pays off. So everything that you need to be a success anywhere else is what you need to be a good doctor too.
All right. So, thank you for your time.